Coronary artery disease, or CAD, is one of the leading causes of death worldwide. It's a condition where the blood vessels supplying the heart become narrowed or blocked, leading to symptoms like chest pain, shortness of breath, or even heart attacks. Two common procedures to treat CAD are percutaneous coronary intervention, PCI, and coronary artery bypass grafting, CABG, but choosing the right treatment can be complex. This video explores the key findings from a major study comparing these two approaches and offers insights to help you better understand their differences. First, let's break down the treatments. PCI, also known as stenting, is a minimally invasive procedure where a small tube is placed in the artery to keep it open. CABG, on the other hand, is open heart surgery, where a blood vessel from another part of the body is used to bypass the blocked artery. The study revealed something surprising. CABG has a survival advantage over PCI for patients with severe CAD. CABG not only reduces symptoms, but also prevents future heart attacks more effectively. Why? The key lies in something called surgical collateralization. Unlike PCI, CABG creates a new route for blood to flow around the blockage, protecting the heart from further damage, even if new blockages develop over time. PCI, while effective at opening specific blockages, doesn't provide this broader protection. Here's an example. Imagine two patients with CAD. The first undergoes PCI and experiences relief from chest pain. However, months later, another plaque ruptures, leading to a heart attack. For the second patient, CABG offers a safeguard by bypassing not just the current blockage but also providing blood flow to areas at risk of future blockages. This difference can be life-saving, especially for people with more complex or widespread disease. So, does this mean CABG is always the better choice? Not necessarily. The study emphasizes that the best treatment depends on individual factors like the severity of the disease, overall health, and personal preferences. For patients with mild CAD or fewer blockages, PCI may be enough to manage symptoms and improve quality of life without the risks of surgery. Both PCI and CABG come with their own risks and benefits, and the decision should always involve a heart team, cardiologists, surgeons, and you, to weigh these factors. If you or a loved one is facing this decision, don't hesitate to ask your doctors about the long-term outcomes and which approach aligns best with your health goals. Remember, CAD is a serious condition, but with the right treatment and care, it's manageable. The key is to understand your options and work closely with your medical team to make the choice that's best for you.